If you are a woman who frequently suffers with pelvic pain or discomfort, frequency, urgency, or burning with urination, having this feeling of pressure within the bladder that doesn't seem to be going away, you might think that you are having recurrent urinary tract infections. And while that is possible, it is also possible that you may be suffering from a condition known as interstitial cystitis, or IC. Hi, I'm Dr. Lindsay Marie. I'm a board-certified family medicine physician, and in today's video, I'm going to be discussing in detail with you the differences between interstitial cystitis and urinary tract infections. Let's get started. As a family medicine doctor, I see multiple patients per day, and at least 2 to 3 of those patients per day, or sometimes even more, up to 6 to 10, are women who come to me for urinary symptoms and likely have a UTI infection. But before we get into the differences between IC and UTIs, I just wanted to give a quick introduction about IC, which is known as interstitial cystitis, and in simpler terms, that basically means inflammation of the bladder. It's a chronic and often painful or even sometimes debilitating condition that affects some women, and that woman could be you if you are experiencing frequent urinary symptoms, so it's important to distinguish between these two conditions. And I'm going to go over those now. So the first difference we need to discuss is the causes of IC versus UTIs. For interstitial cystitis, unfortunately, it can be one of those complex conditions where the cause remains unclear. But it is believed to involve some nerve dysfunction or other autoimmune factors that affect the lining of the bladder, which is known as the epithelium. It's important to note that IC is not caused by bacteria. A UTI, on the other hand, is caused by a bacterial infection, and the most common bacteria causing UTIs includes E. coli. It occurs when this bacteria enters in the urethral tract. It can then spread up the urinary tract and lead to worsening infection. The second difference I'm going to discuss between IC and UTIs is their symptoms, and they can be very similar, so that's why it can be hard to distinguish. For your basic UTI, it typically presents with frequency of urination, having to go more often, urgency of urination, that feeling of I gotta go right now, and burning with urination, which can range from mild to moderate to severe. With a UTI, you can also notice cloudy urine. You can feel pressure within your bladder or sometimes feel worsening fatigue. And if a UTI is getting worse, you can have blood in the urine, back pain on one side, or fever. And this can indicate that the infection is spreading up toward the kidney. UTIs usually come on suddenly and are directly related to a bacterial infection. And now for the symptoms of interstitial cystitis. Interstitial cystitis usually comes with symptoms of chronic pelvic pain or discomfort. You can also experience symptoms of frequency or urgency with urination, and when you do urinate, you might only have small amounts of urine that are produced, and you can sometimes experience pain during intercourse. The next difference is diagnosis. Diagnosing a UTI is fairly straightforward. Now that I work in telemedicine and urinary tract infections are very common for most women, we can oftentimes diagnose over the video call based on symptoms alone. Otherwise, if you presented to your doctor in clinic for symptoms of a UTI, they would most likely take a urine test. The urine test provides 2 basic markers that we look at to diagnose a UTI, and those include leukocytes and nitrites. Usually both are positive for a UTI. Your doctor may then send your urine off to the lab for a urine culture and sensitivity, which basically shows which antibiotics would be best to treat your specific UTI. And that's how a UTI is diagnosed. Diagnosing interstitial cystitis can be a little bit more challenging. It usually involves a process of exclusion, meaning you rule out all other conditions before concluding that the condition is interstitial cystitis. Again, since IC is not caused by bacteria, you would likely have a negative urine test. Other tests that can be done include cystoscopy, and this is where your doctor uses an instrument or a scope to be able to look inside your bladder. They can also take a biopsy if needed to look more closely at the lining of the bladder under the microscope. This might provide more information about what's going on at the cellular level, where they can actually see more of the inflammation of the bladder itself. The next difference between IC and UTI includes treatment. UTIs are treated with antibiotics to help clear a bacterial infection. There are some antibiotics that are considered first-line choices, such as Macrobid or Bactrim, but if those aren't working, you may have a UTI with a different bacteria that is only sensitive to a specific antibiotic, which you would find on the culture and sensitivity. Once starting an antibiotic, symptoms of a UTI typically improve within the first 1 to 2 days. However, it is important to complete your full antibiotic course to prevent any antibiotic resistance. Treatment for interstitial cystitis is going to be a little bit more in-depth, but the main focus is going to be on symptom relief. So even though IC is not caused by bacteria and is not considered an infection, sometimes a doctor will prescribe a patient with antibiotics. And the reason is because some UTIs that were not treated on time or thoroughly can turn into chronic symptoms of UTI. So the thought is treating it with an antibiotic may still help. And if that's not working and you continue to suffer with recurrent urinary symptoms, there are other treatment options to be tried. And those can include 1, lifestyle changes, and this may involve avoiding anything that irritates your bladder or puts pain or pressure on your pelvic area. Unfortunately, sometimes that may mean making a change in your sexual activity. The second way is with dietary modifications. There are certain foods that are known to be bladder irritants, and these can include spicy foods or food or drinks with caffeine. Another treatment option is with medications to help reduce your bladder pain or inflammation. Physical therapy can also sometimes help to strengthen your pelvic muscles, those muscles that are surrounding the bladder and providing extra support, thus limiting the chances for bladder spasms and pelvic pain or pressure. There is also something known as neuromodular techniques, and these techniques help to reduce nerve dysfunction and pain. And lastly, there is something known as bladder installations, which is a small device placed directly in the bladder that helps release pain-relieving medications. Last week's video was all about UTIs and geared for women who tend to get recurrent urinary tract infections. Like we just talked about in this video, it can sometimes be hard to tell if you have recurrent urinary tract infections or interstitial cystitis. So if you want to learn a little bit more, make sure to check out that video. I will link it at the end and also in the description box below. IC and UTIs is a pretty wide topic affecting millions of women worldwide, and so this is a topic I could do more videos on. If that would be something you're interested in, let me know in the comments below. I like to make educational videos on some of the most common health conditions, and I also like to focus on wellness and nutrition for prevention of disease. If you have another health-related topic you would like to learn more about, let me know and I can add it to my list. Please like and share this video with anyone who may benefit from this information, and don't forget to subscribe as I will be making new videos in the future. Until next time, bye!